Hello, everybody. I'm Kate Bergstrom, Associate Commissioner at the America East Conference, and thanks for tuning in to this episode of the Three Pillars Academy. The America East Three Pillars Academy focuses on providing professional development and educational opportunities to administrators, student athletes, and coaches from both inside and outside the conference. Athletic excellence, academic achievement, and leadership on and off the field. These are the three pillars of the complete student athlete of the America East Conference. Today, I am thrilled to be joined by Darcy Gruttadaro, Director of the Center for Workplace Mental Health at the American Psychiatric Association Foundation. Darcy joined the APA Foundation in 2017 and currently works to develop and implement the center's strategic direction, bringing both public and private organizations to a place where they feel that they have all the resources to create mentally healthy workplaces. Darcy came to the center after a 17-year tenure at NAMI, the National Alliance of Mental Illness, which is actually when I had the pleasure of first meeting Darcy. While at NAMI, Darcy focused on initiatives to expand access to effective mental health services and to support people across the country. Starting her career as an attorney, Darcy earned a bachelor's from Clarkson University and a JD from the Western New England University School of Law. Spending time in the college athletics world, both from a professional and personal perspective, it's worth noting that during Darcy's tenure at NAMI, she was the primary author of multiple publications, including one that many in the college field have likely read, Starting the Conversation, College and Your Mental Health. Today, we're going to be discussing the mental health landscape. We're going to break down the stigma a little bit, talk about how you can take a holistic approach to mental health, and hopefully leave you all with a few key takeaways on creating more mentally healthy environments, not just for your student athletes, but also for your whole athletic departments. So Darcy, thank you so much for joining me today for this important conversation. We're really thrilled to have you.
I'm very happy to see you again, and I'm really happy to be talking with you today. So thank you for inviting me.
So let's just start sort of, pretty broad and high level, college and mental health, right? So let's talk about the landscape, some of the trends that we're seeing. I think when you and I first connected, we talked a little bit, 75% of mental health conditions are beginning at age 24. The NCAA has come out publicly and acknowledged that mental health is the number one health and safety concern right now for them as an association. So just, what trends are you seeing in students that age and sort of just talk to me a little bit about the national landscape.
Sure, and I really have to say kudos to Dr. Brian Hainline, who recognized the importance of focusing the NCAA on mental health. It's just wonderful to see that kind of leadership. I would say things haven't changed a lot in terms of the fact that mental health is a growing concern on college campuses. When I say hasn't changed a lot, over the last several years, we've really seen a growing trend in the number of students that are coming to college experiencing depression and anxiety. And the fact that colleges and universities are really struggling with how to address their needs. They're not necessarily staffed up in their counseling centers and in the mental health resources and services that are available to really address the needs of students. So we see suicide is at a 30-year high. There's real concern around youth and young adult suicide. So there's a lot of risk. And so really as a nation, we should all be looking to the future leaders on our college campuses and especially student athletes and making sure they're getting what they need because these numbers are concerning.
Are there particular things that you can talk a little bit about in terms of how athletic departments can structure an environment that will create sort of a holistic approach to mental health?
Well, we really talk about it in three buckets. So the first bucket is really around raising awareness, educating, and informing student athletes, coaches, athletic directors, college administrators, staff about the fact, what the early warning signs are of mental health conditions. Because what's really essential is that when people begin to experience it, they're identified and connected with care. So there's awareness, educating people. In that first bucket too is this whole anti-stigma idea. We're really stuck in this mode of mental health remains a topic that people feel uncomfortable talking about. We're seeing some exciting movement forward, I think, away from that idea, but it still exists in many places, so we have a lot of work to do there. The second bucket we really think about is creating a culture and climate that's accepting of mental health as a part of all of our existence. We all have mental health. So whether mental health is in a very good place or whether it's in a concerning place, we all have it. So when it's in a good place, we want to promote continued good, strong mental health. We want to take preventative measures so that we don't see people go from mental health to mental health conditions or mental illness. So creating that culture and climate is really about leadership. It's about athletic directors and coaches and deans of student life and college administrators really talking about the fact that mental health is a priority. There are, putting posters up, putting information up in locker rooms and training rooms and in bathroom stalls on the back of the door about mental health. So it's highly visible. And there's a real commitment and talking about it in a way that's normal, as we would about weight, we would about nutrition and sleep and other health issues. And then the third bucket is really access to care, because it's one thing to educate people about mental health, to create a culture that makes it safe for people to come forward. But then the question is, how easy is it for them to get access? Are there wait times to get care? Is there help available? Is there a crisis line people can call if it's in the evening or on the weekends or at odd hours? So really making sure that everyone understands how to navigate the system so they can connect with care when they need it is extremely important.
Talk to me a little bit about how important it is to get that buy-in from the top down. The person sitting in the seat that's making those decisions to help normalize the conversation.
I'll give you a couple examples in the corporate world, and I think this is very translatable to the academic world. So Ernst & Young has a wonderful corporate mental health initiative, and it really started with senior leadership coming forward and talking about personal experiences with mental health. Whether a college president or a dean of student life or an athletic director, most of us have a connection in some way to mental health and or substance use. Telling those personal stories, talking about what it means to experience that, some of the pain, some of the challenges, the importance of getting treatment when you need it. I think too, showing some of the film clips from the recent disclosures of Kevin Love, DeMar DeRozan, and others, I think there have been some NFL football players that have come out, showing those film clips and letting athletes know that it's a sign of courage and strength to come forward and get help when you need it. And, just that introduction and that idea is really important. So Ernst & Young did that. There was a recent media story about the Cisco CEO who talked about mental health at a large gathering of employees. Shocked afterwards to have 100 employees come forward and talk with him personally or communicate with him about the fact that they were experiencing mental health conditions. And experiencing, the need for mental health care. So it's when we open the door with leadership that it helps people to feel more comfortable. So on a college campus, that could be anyone in the upper echelons of administration or the athletic structure to come forward and just talk about a family experience, a friend experience, a close friend they've heard about, and just to say, these are conditions like any other health condition. We need to catch them early. We need to get help early. And we can be all that we want to be in life. And we've seen that with people like Kevin Love and DeMar DeRozan and others in terms of athletes. Because the one thing you want to get away from is this idea that somehow you're soft or you're not tough or you can't stand the pressure and that you're cracking, and that's why you're experiencing a mental health condition. These are health conditions like any other. And the more we reinforce that, the more athletes will understand it and feel comfortable coming forward and getting help.
In our own league, we've had, the head coach of the UMBC men's basketball team, Ryan Odom. He came forward and was in an article written last year about, the challenges that he's faced as a family, and his son has OCD and sort of what that's meant for him. And that, that I think it really normalized the conversation and it just completely destigmatized this, especially after their big win in the tournament last year. It put sort of a human face behind this crazy feat. And so, things like that I know have a resounding effect. Talk to me about what, as a student athlete maybe, or an athlete or an employee that is reading an article like that, like what's happening for them that's sort of breaking down and normalizing that? Maybe just talk to me about that process.
I think the impact would naturally be, oh my goodness, this is describing what I'm experiencing. It must be okay to talk about it if the person in a leadership role has opened up the conversation.
Yeah.
So the fact that I'm hearing it means it's probably safe for me to say something about it. And we always, I think we have a tendency to connect conversation to what we hear and see. So being able to go up to a coach and say, hey, coach, I saw what you wrote, and I just want you to know that I experienced that too. And I'm doing well. I'm getting help. Sometimes it's hard. It's a conversation opener. It's a way to connect with another person. It's a powerful way to make it okay to talk about it. Yeah. And I've seen that time and time again. I think the Kevin Love experience, seeing him come out on Twitter, seeing other people come out after him, he opened the door and made it okay. And that's just a prime example, especially in the athletic world, because stigma can run high. People are worried about losing their spot on the team. They want to look as strong and well-equipped as possible and at the top of their game.
Right.
So it's really important to reinforce with athletes that just as you would get help for diabetes, or just as you would get help for any other health condition, getting help for mental health means you're right back on the court or right back on the field, and you can perform at the highest levels. We're seeing that now.
I guess sticking with bucket number one and talking about the stigma a bit more, what else have you seen, Darcy, to help sort of break the stigma down and fight it, whether it's in the workplace or on a college campus? What are the other mechanisms that can be put in place in an organization to fight that stigma and break it down and create space for conversation?
One way is to invite in a speaker who lives with a condition. So really to hear firsthand, and that's actually a researched and studied method, is bringing in someone who can kind of break those stereotypes and myths that people have in their minds about what mental health looks like. That firsthand encounter is really important. Then educating and informing people so that you can speak about it in a way you would any health condition. So you can say, these are the early warning signs, just as you would with any other condition. What's really important is 10 warning signs, get help, treatment is available, treatment works, and people get right back in the game. So sending that message through education, and there are education programs that are available from a number of different fronts. I think too, seeing it visible on the campus. So I've been on campuses where they have on the back of the bathroom stall a poster that talks about mental health and the importance of getting help and where to go to get help. Social media campaigns. There are clubs on campus like Active Minds and NAMI on campus that help to make mental health more visible. That's important. I think colleges and universities are doing things during finals time and during high stress points during the academic year to address stress. That's a great time to tie it to depression and concerns around that. So when you bring in puppies or when you bring in massage therapists or you bring in stress balls, saying, we're really concerned about your stress because stress can lend itself to depression, and depression can be quite problematic for anyone, and anyone can develop depression. So it's really, and then talking about, especially with student athletes, especially in their first and second year, they're away from home, they're suddenly experiencing travel on weekends, academic pressure along with travel time. So all of those factors make the likelihood of anxiety and depression go up. So that's a really important time. The other thing we're seeing more and more of is a focus on mindfulness and meditation. So really talking about how mindfulness and meditation are preventative measures to deeper, cases of depression and anxiety, that they really help students to keep their mental health in check. And also talking about how prevalent these conditions are. I think students forget, and we all forget, that 20% of the population will experience a mental health condition in their lives. That's a lot. That's more than many health conditions. So just normalizing it in that way.
The access to care can really, span a pretty wide variety. Maybe just talk to me a little bit about sort of the obstacles around that third bucket. And then also, what are the solutions when you don't always have all the resources, that you might wish you did?
A great question, because access to care is essential. Once you've kind of normalized in bucket one and really educated the community, the whole campus community, and then you've got your culture and climate in place where people feel safe, then they're coming forward to get help. It really needs to be there. So there's two ways to look at this. There's one, the student athletes, and whether or not they're getting the help they need when they need it. And there's a lot of focus now on college campuses around counseling centers being overwhelmed. So there the question is, what do the wait times look like? What are the numbers in terms of students that need help versus the number of counselors? Where are counseling services available on campus? Is it integrated with other healthcare, or is it in a separate facility farther away, or where students might feel stigma about going in to get help. Are services paid for? Are there limits on the number of services? What if students really need serious help? Is there connection to psychiatrists in the community for when there is that need for overflow? Are there crisis after-hour services available? And then on the workforce side, on the coaches, administrators, all of those who are actually working within the athletic framework in the athletic department, what's essential is making sure some of the same things apply. So in other words, can they get care on campus? If not, what kind of insurance plan is available to them? Are there psychiatrists and mental health professionals in the network? Because a lot of times there aren't enough in the network, so that even if you can get an appointment, you may find out that no one's taking new patients, they don't accept insurance, it can be really cost prohibitive to get care. And then the other question is, what kind of care are people getting? Because quality matters and effectiveness matters. So for example, with depression, you want to make sure that people are getting a combination of medication and therapy. So writing a script is not enough. And so someone needs to be paying attention to what is the quality of care that's delivered, what kind of outcomes are we seeing, what kind of accountability is there, and can people even get in the door with an appointment? Or is it cost prohibitive, or the wait times are too long? So there are so many issues around access. And I'm not sure, I'm sure it's structured very differently from school to school in terms of whether there is on campus, what the health plan looks like, how extensive the mental health professional network is, what kind of care people are getting, but all of that really matters.
What are the things that those administrators and those coaches can do that doesn't require as much resource to create environments for themselves, to make sure that they feel prepared to, be an advocate for mental health?
That's critically important, because the relationship between a coach and an athlete is so important to all. So I would say a few things. One is keeping a good work-life balance. That's very important. I'm sure it's not easy to do when you're a coach and you travel and you're away a lot.
Right.
Also, I think if they want to get more comfortable in having their athletes feel more comfortable coming to them, maybe connect with a student counseling center and have meetings with them to talk about, how do I better understand mental health? How do I have conversations with my athletes that'll help them feel more comfortable coming to me? How do I think in terms of their taking care of themselves, that's a very important aspect of this, because they're obviously under a lot of stress.
Right.
And what'll be important to them is, I think, to do the same kinds of things that you would expect athletes to do. I mean, I think mindfulness, meditation, if they can find the time to do that, and if they believe in it. I think keeping their stress at a manageable level, recognizing the connection between stress and mental health. I think raising their educational or informational level on mental health will make them, help them feel more comfortable communicating to athletes that if something is going on with their mental health, it's okay to come to them. The more they know, the more they can convey that sense of confidence. They can open up conversations that might help athletes feel more comfortable. It's pretty obvious when there's someone else in the room who you think doesn't know enough about a topic you want to start a conversation on.
Right.
So what coaches really, and athletic directors and others, can do is raise their knowledge level and their educational level about mental health. There is so much now online. For example, the NBA just put together this whole NBA Cares new website. It has lots of great information. It's not just for the NBA, it's for anyone who really wants to learn more about mental health. So that's a great place for a coach to start. But I also think it's okay for a coach to say, I don't know enough about this. I want to learn more. I just want you to know it's safe and it's okay to come to me, and I'll learn along with you if we need to learn together. I think communicating that slight vulnerability around it can really open doors to athletes feeling more comfortable and recognizing, like, I can see my coach cares and wants to learn more about something that's a part of my life. So now I feel safer coming forward with my coach.
One of the things that I've heard from them is, wow, when I got into coaching, I wasn't expecting to have to also play the role of a counselor. It's been really challenging for me. And often my response to them is, as long as you're creating a safe and secure environment for the student athlete, you're not expected at any point to give any sort of clinical help or anything like that. Really the important thing there is to make sure that the student feels safe, secure, and then is put in the right hands, depending on what the issue is. And so some of the initiatives that we've done here is making sure that coaches understand, whether it's a crisis situation or a routine situation, is do you know who to communicate with and where to send that student athlete so that they can get the proper help.
Tremendous advice that the handoff is very important when the circumstances are right, but recognize how powerful it is for a coach to be that first point of contact for an athlete that trusts them, but is still a little afraid. Helping athletes understand that it's okay and it's safe is an important role to play, but then also having the coach really focus on self-care, because self-care is important when you're the go-to person for an entire team.
In this age, we're collecting more and more data on our student athletes. And so whether it's them filling out a survey every morning that talks about, how stressed they're feeling or how many hours of sleep last night they got, it's empowering for coaches to be able to make data-driven decisions and say, hey, maybe I won't actually, tack on an extra hour of conditioning today or film because it sounds like they need a break or they're stressed. Talk to me a little bit, Darcy, if you would, just about the importance of data also in the conversation.
So data is very important because it offers coaches an opportunity to really look at trends, and trends are extremely important across. So if you have a coach who's seeing patterns of student athletes who are at high levels of stress, who are not getting enough sleep, who are just really not feeling great, it's a sign that they need to take proactive steps. So at that point, I think it's important to have conversations. There are probably times during the season when that's going to be true, and there's certain expectations around that.
Right.
Coming out of the blue a little bit, then it's really important that they act on the data. So they talk to the athletes about the fact that we're seeing a pattern here and we are concerned about the stress levels. And what we want to do is say, let's unplug a little. Let's really think about self-care. Let's take some time away if we can, even if it's an hour or two. So, recognize that students, taking it out of the student athletic realm, they are so rarely unplugged. They so rarely have quiet time.
Right.
So a coach brings in a mindfulness expert to say, we're going to spend 20 minutes today really looking at mindfulness and talk about the professional athletes that are using mindfulness to up their game.
Right.
So that's the other thing is some of this meditation and mindfulness can be used positively to share with athletes that there are professional athletes out there doing great things with preventative measures and health promotion on the mental health side. That's another way to really, but the data is important to really keep track of, look at trends, and really begin to ask yourself, what can we do differently to really focus on health and mental health promotion?
It's one of those things that for a coach to be really intentional about potentially, whether it's once a week or once a day at practice, starting off with 5 minutes or 10 minutes of allowing a student athlete to have that time because, their schedules can be so, chaotic that carving out that time and making intentional space for it probably has a really lasting effect.
I think making space for mindfulness, making space for gratitude, have your student athletes keep a gratitude journal, and the first part of their practice, the first 5 minutes, is write 3 gratitudes from your day today. These are preventative measures that really help with mental health and wellness.
Yeah.
Mindfulness or meditation or, unplug a bit. And it's actually good for coaches as well. So if the coaches are engaging in it too, at the same time that the athletes are, I think it has a reciprocal effect. But also open conversations saying, I'm looking at the data and I'm seeing that our stress levels are high. People are not getting enough sleep. That's important. That's a great way to open up the conversation about mental health.
As a final, sort of parting piece here, just curious, I mean, we're in an age today where while we're, and you ticked off a couple stats that are really hard to swallow, third year of a suicide all-time high. We talked a little bit about just the sort of generation of college kids that are coming in now, more stressed and more anxious than ever. What, as we move forward from here and we're about to tick into 2019, what do we have to look forward to?
Great question. I would say what's exciting is that we're seeing mental health as a much more visible issue. So I think what I'd like to see is student athletes really take on a leadership role in terms of helping to raise the visibility. I think the more we all engage in that, so corporate America is definitely fully engaged in, especially larger organizations, fully engaged in mental health. So as student athletes graduate, they're going to likely move into, if they work for larger companies, they're going to move into a space where employers are really engaging in workplace mental health, which is really exciting. So it's a perfect time for student athletes to get to know mental health better, because it will be a part of their workplace when they go into large organizations when they graduate, should they decide to go that route. Yeah. I think too, we are sort of at a tipping point where I think some high-profile suicides and real concern that things must change are going to pivot us into really a much more open dialogue, a much more open community dialogue. People really are embracing this holistic health. So it's not just mental health versus physical health, it's full-on total health. And that's really exciting because that's how we need to be looking at this. So my hope is that the future is very bright. I think we will have much more open dialogue about mental health, and I think people will be more willing to get help when they need it, because we have people in high places talking about the importance of it and making it okay to do so.
Well, thanks so much, Darcy. I really appreciate it, and happy holidays to you, and thanks again for the time and the expertise you've shared with us today.
Great, happy to be here. Thank you so much for inviting me, and keep up the great work.